Dr. NGR Educational and Research Institute, University, Madurai, Chennai.
शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः शत्रुबुद्धिविनाशाय दीपज्योतिर्नमोऽस्तु ते दीपज्योतिर्नमोऽस्तु ते शुभं कुरु त्वं कल्याणम् आरोग्यं धनसम्पदः.
Good morning, everyone. It's a very great welcome we bring you this morning filled with desires, hopes, and all dreams we share. I'm G. Arita, first year department of BTech Biomedical Engineering, and I'm very much glad to excite and host this show faculty on the occasion of International Women's Day associated with NSS. We have gathered today to gain an insight into the common gynec issues faced by adolescents and young women. Let's start this off with a welcome speech by Dr. S. Radha ma'am, Assistant Professor in Chemistry.
Good morning all. I am very glad to welcome on this wonderful event. First of all, I extend my heartfelt welcome to our Founder Chancellor, A.C. Shanmugam Sir, our Honorable President, Engineer A.C.S. Shanmugam Sir, Vice Chancellor Ma'am, Provost, Rectors, Registrars, Additional Registrars, and all Joint Registrars. Next, I would like to extend my warm welcome to this to the guest of honor. Today's guest of honor, Dr. Poornima Shankar, consultant, obstetrician, and gynecologist, Sri Lalithambika Medical College and Educational Research Institute. And we welcome you, ma'am. And next, I welcome our joint registrar, ma'am, Dr. N.S. Shubhashri, first year engineering and technology, for this wonderful occasion and to start this program in a wonderful manner. I welcome you, ma'am. Next, I would like to extend my warm welcome to all the deans, additional deans, teaching and non-teaching faculty members of all the departments, technical team, and students, and those who have joined in this wonderful program. And once again, I welcome you all. Thank you.
Thank you, ma'am, for making us feel welcome and feel grateful to be here. Next up, we have our very own Dr. N.S. Subhashri, ma'am, Joint Register, first year ENT Technology. A leader is the one who knows the right way, guides the way, and shows the way, and travels in the way. Let me hear a few words from our Dean, Joint Register, ma'am.
Thank you. Woman, a wonderful wife, outstanding friend, marvelous daughter, adorable sister, nurturing mother. Let's rejoice ourselves being women, most beautiful of God's creation, who knows the art of living and loving. Keep smiling. World is a dreamland. Happy Women's Day to one and all present here. This is a day for us to remember that we are always special. The first year ENT team, along with NSS, record their gratitude to Honorable President for his unconditional support in hosting such events. On behalf of the team, I welcome Dr. Poornima Shankar, and thank you, ma'am, for gracing this occasion today. It is very apt that you are present here today to educate our young students. Women's Day 2023 is celebrated on the theme Digit All Innovation and Technology for Gender Equality. The theme highlights the role of innovation technology in promoting gender equality and meeting the health and development needs of women and girls. Globally, the increase in number and use of mobile phones and internet connectivity have facilitated access to health information and services. Innovation have equally enhanced capacity building and knowledge translation through online training, webinar, and innovation tools for patient care. Today's program is a classic example for such a theme of celebration of Women's Day. This very well aligns with the theme of this year's Women's Day. With these few words, I conclude my speech, and I hope this session will definitely be an eye opener for all women. Once again, welcome you all and happy Women's Day to all.
Thank you, ma'am. As always, you have given the wonderful start here. Now I call upon Meena, first year Department of BTech Biomedical Engineering, to give a brief introduction on our Honorable Chief Guest, Dr. Poornima Shankar, ma'am.
Good morning, everyone. One of the marvelous things about community is that it enables us to reach out and help people in a way we couldn't as individuals. With that being said, let's welcome our beloved chief guest, Dr. Poornima Shankar. She's a remarkable woman who has been doing her part for the society tirelessly and selflessly. She completed her MBBS at the Madras Medical College and MSOG at the Government Heel Park Medical College and emerged with flying colors as the gold medalist. Her achievements are just getting started though. She is also the recipient of Professor Dharani Gold Medal, Dr. Meera Sen Gupta Gold Medal, R.H. Kulkarni Award, among others. On top of this, she has also obtained the DND from the National Board of Examinations and cleared the MRCOG from the Royal College of Obstetricians and Gynecologists in the United Kingdom. She also has an immense work experience of 7 years, throughout which she has displayed her excellence, starting out at the Chettinad Medical College and now works at our very own Sri Lalitambige Medical College and Hospital as a consulting obstetrician and gynecologist. The time we spend with her today will undoubtedly be a great learning experience. We welcome you, ma'am. The floor is yours.
Hello everyone. I thank you all for giving me this wonderful opportunity to talk to all young women and young girls. And I'll directly go to the talk. And if you have any kind of questions, or if you would like to interact in between, please feel free to put it in the chat box, and so I can answer the questions. Otherwise, we can also have a Q&A session at the end. Okay, and on a starting note, I would want to wish all the women here very, very happy Women's Day 2023. Okay, and I'm going to talk a few things about common gynec issues faced by adolescents and young women. Hope that would be useful for all of you all. Okay, and please feel free to have a discussion and interaction also. Okay, without dragging on much, so let me go into my topic. So I will be just sharing my screen. So I hope everyone is able to see the PowerPoint as well. Can someone confirm?
Yes, ma'am, visible.
Okay, thank you. Okay, so basically, adolescents are the greatest resource for a society to thrive. So these are the things that are taken from WHO. What they feel is investment in adolescents bring a triple benefit, like they grow into healthy adults in the future, and they form healthy future generations. So the adolescent health is really important in this aspect. So basically, so you all would have just finished your high schooling and probably just entered the college life. So it is a child or adult phase of life, isn't it? So adolescence is basically a transitional stage of physical as well as psychological development. So it is usually associated with the teenage years, as we all are. Okay, so this is a basic, classification of adolescence. So when you're 10 to 14 years old, it's called as early adolescence, and when you're 15 to 17 years old, it's called as middle adolescence, and 18 to 24 years old is called as late adolescence or early adulthood. So most of you all would be in your middle adolescence, or some of you may be in your late adolescence or early adulthood. Okay, now I'll be dealing about the common problems, okay, that can happen, common gynec issues especially. Okay, so let us go straight away. So now, first thing which I would like to tell is about anemia. Okay, so anemia is, basically when, the hemoglobin levels are low, or in our terms, we say the oxygen carrying capacity of the blood gets reduced. Okay, these are the, symptoms of anemia, which is very common in our country. Okay, probably because we don't take adequate iron-rich foods. Okay, so there may be fatigue and tiredness, the shortness of breath in severe cases. Okay, there may be hair loss, the nails may become brittle. Okay, and there may be frequent headaches or leg aches, etc. Okay, so as I said, it's basically decreased hemoglobin levels. Okay. So the symptoms may also vary. So it is not that everyone should get all the symptoms. Okay, so some people may also have dizziness. Okay, so generally they may have feel giddy most of the times, and if we check the hemoglobin levels, that may be low, and that could be the reason for the giddiness also. Okay, and suppose a patient is, when a person is anemic, okay, there is a chance that they may have reduced immunity. Okay, so immunity is nothing but the ability to fight infections. Okay, so if that gets reduced, they become more prone for infections. So that much important is, to maintain the hemoglobin levels in the body. Okay, what to do if there is anemia? So if you have any of these symptoms, so definitely we have to take a consult, okay, from a doctor. And the first step which we do is, we will examine you clinically. Okay, and we will be running some blood tests on you to see what is the hemoglobin level. Okay, and if it is a very mild anemia, then the first step would be to start off with, high protein and iron rich diet. So we can try to improve the hemoglobin levels by having a good diet. Okay, and so what are the diet that are rich in hemoglobin? So mainly green leafy vegetables. Okay, and liver, meat. Okay, and a lot of pulses for protein. So proteins are also very important in anemic patients. Okay, so consumption of eggs, okay, and consumption of pulses are all very important. Okay, so if the hemoglobin doesn't improve by all these means, okay, then you may be needing some kind of iron tablets or injections. Okay, and one more reason is there may be some worm infestations, like for children. Adults may also have some worm infestations, so that may lead to anemia. Okay, so that also has to be treated as a part of our treatment for anemia. Okay, so this is one common issue that young girls or young women may face. Okay, and this needs kind of medical attention. So next, most of you may be wondering about this white discharge from the vagina down below. Okay, so I would want to highlight a few points about it. Okay, so I want to emphasize like when it is normal and when we should consult a gynecologist. Okay, so that is the most important thing I feel, because many of my patients who are coming to me, so they get scared, especially young girls or young adults. They get scared of this, and since they don't understand which is normal and which is abnormal, and most of them come to us. Okay, so when to meet a gynecologist. So this is what I want you all to know. So most of the time, this kind of vaginal white discharge is perfectly normal. When white discharge happens normally, so before your periods, after your periods, or during ovulation, which we say, which means when the egg release happens. Okay, so probably sometime in the mid cycle. Okay, so these are some times when white discharges are absolutely normal. Okay, so when you should have concern, when you should meet the doctor. Okay, so if the discharge is, kind of a thick, curdy discharge in its nature, or when there is any kind of associated vaginal itching, burning, redness or rash in that region. Okay, or if it is associated with pain while passing urine. Okay, it's important to meet a gynecologist, because it could be a sign of infection. Okay, so then we'll have to examine you and treat you accordingly to get you relieved of the symptoms. Okay, so let me give some few tips to prevent vaginal infections. So basically, personal hygiene of the perineal region. Okay, so it's very important. Okay, so um, okay, so some few tips are like the private part should be washed with gentle, mild soap and warm water regularly. So never use scented soaps or sprays. Okay, always wipe from front to back. Okay, to prevent bacteria or germs from entering into the vagina. Okay, and it's always better to avoid tight clothing. Okay, and it's advisable to wear cotton undergarments, and the undergarment should be washed with mild soaps or detergents, and it is strictly advised that disinfectants like Dettol, Savlon, Lysol, etc. should not be used for washing the undergarments. Okay, so that itself might cause irritation, itching, allergic reactions, and these kind of vaginal, and you know they may become more prone for developing vaginal infections as well. So this is about white discharge, and now the next problem is faced only by a few people. So most of them are healthy. So heavy bleeding during periods. So what is heavy bleeding during periods? So when the bleeding lasts more than 7 days, okay, or when there is passage of clots during periods, or when the cycles are more frequent, like when you get once in less than 21 days. Okay, so 21 to 35 days cycle is usually taken as the normal cycle frequency. Okay, so anything more frequent than once in 21 days, then it is considered as a heavy bleeding. So, what are the reasons of heavy bleeding in this age group, especially adolescents and young adults? Is most probably a hormonal immaturity. Okay, so as I already told, it's a transition stage, a child or adult stage. So the hormones also will be changing from the children's pattern to an adult pattern. So that kind of immaturity may cause these kind of heavy bleeding. When there is a hormonal imbalance like PCOS, so which I'll be talking about in some time, and very rarely there can be some blood disorders. So when you feel the bleeding is heavy, like as I said, if any of these are present, then it's important to consult a gynecologist and get it evaluated to know the cause, like why it is happening, and it has to be treated. Okay, otherwise. A lot of blood loss can cause anemia again. Okay. Okay, so this is about heavy bleeding during periods. And next, one common issue faced by adolescents and young adults are pain during periods. Okay, so I just want to highlight a few things here and there about that as well. So, lower tummy pain just before or during periods may happen. Okay, for some it could be a mere discomfort, and for many it could be very severe also. So first day pain during your periods is perfectly normal, okay, and it indicates that your system is healthy, okay. What are the associated symptoms that can be there along with this pain? So there can be some back pain, some loose stools, nausea, vomiting. Okay, sometimes there can be headaches, giddiness, and extreme tiredness. So it varies from person to person. So some people may have, some kind of complaints, and some others may have different. Okay. So, what are the self-care measures that you can do when there is, pain during periods? So, you can lie on your back and place your legs on a pillow. So that may give some kind of comfort. Okay, a gentle heating pad can be used. A gentle massage on the abdomen or your tummy can be tried. Okay, a warm bath can be taken. Okay, so these are some self-care tips. So if none of these is helping you, then it's better that you can consult a gynecologist for medications for pain. Okay. So next, so scanty flow during menses. So many of my patients keep coming asking that the flow is scanty, but one second. இப்போ வேண்டாமா டாக் போயிட்டு இருக்கு டாக் போயிட்டு இருக்கு இப்போ வேண்டாம் ஆமா வெளியில இருங்க இங்க வேண்டாம் okay, I'm sorry for the interruption. Okay, and so the next topic is kind of the irregular periods. Uh, One second. Scanty flow. I'm sorry. So scanty flow during menses. You need not worry if your cycles are regular. Okay. If there is a monthly bleed, but just that the flow is less, it's not to worry. Okay. So many patients come asking for that, and most of the times we kind of reassure it. Okay. So next topic is irregular periods. Many patients of adolescents and young age group they come complaining of irregular periods. Okay, so as I already told, cycles once in 21 to 35 days is considered normal. Okay, so infrequent cycles is a common complaint more than frequent cycles. So getting cycles once in more than 35 days or kind of delayed cycles are more common. Okay, so what are the reasons for this kind of irregular periods? Basically, stress can cause irregular cycles. Okay, sleep disturbances and dietary habits. Okay, so unhealthy diet can also cause irregular periods. When there is a lack of exercise, lack of physical activity can also cause irregular periods, and obesity. So, if there is more weight gain or kind of excessive weight, overweight, that can also cause irregular periods, more of an infrequent cycles. And then there can also be some kind of hormonal causes, okay, or thyroid dysfunctions, etc. And one other cause is the polycystic ovarian syndrome, which I will be talking to you shortly. Okay, so the thing which I mainly want to keep you all aware is that so any deviation, okay, from the 21 to 35 days cycle, you can get a consult from your gynecologist, okay, to just to know what it is. Okay. Okay, so next, most common issue, faced by many young women is PCOS. Okay, so there is a lot of awareness about PCOS. Many people they get scared by the term PCOS. Okay, so I just want to enlighten a few points about PCOS. Okay, so what is basically PCOS, and what should be, how we should go about it. Okay, so it has now become a very common terminology. Okay, so polycystic ovaries are, nothing but slightly larger than normal ovaries. Okay, and there are something called as follicles in the ovary, which are nothing but fluid filled spaces within the ovary that release the eggs, okay, when we ovulate. Okay, so that is called as follicle. So I will be mentioning hereafter as follicle. Okay, so there will be more number of follicles. Okay, and the ovaries are also slightly larger. Okay, so this is only called as a polycystic ovarian syndrome. Okay, so what are the symptoms of PCOS? So that can be irregular periods or no periods at all. So that can be an increase in facial or body hair. Okay, so that may be a male pattern hair growth. Okay, which we call as hirsutism in our terms. Okay, so that can be loss of hair on the head, and that can be excessive weight gain. Okay, so either that can be excessive weight gain, or that can be difficulty in losing weight. Okay, that can be oily skin, acne prone skin. Okay, that can be development of acne, and some people have difficulty becoming pregnant because of some reduced kind of fertility. So it's all related to the egg production. So basically, we diagnose PCOS with a scan, and we run some blood tests, okay, to see what are the effects of PCOS. Okay. So so why are we worried about PCOS? So there are some long-term risks due to PCOS. It doesn't mean that everyone with PCOS will develop all these things, but since there are risks of all these, so it's better that we go for some lifestyle changes. So which I'll be telling you now. Okay, so some of the long-term risks associated with PCOS include diabetes, high blood pressure, okay, snoring, daytime sleepiness, depression, okay, and rarely there may be cancer of uterus in future. So these are some risks that can be associated with PCOS. ஜஸ்ட் மினிட், நான் ஒரு டாக் போயிட்டு இருக்குமா, இங்க வர வேண்டாம், கொஞ்சம் வெளியில இருங்க. இப்பதானே நான் சொல்லி விட்டேம்மா, கொஞ்சம் ப்ளீஸ், லைவ்ல போயிட்டு இருக்கு. Sorry for the interruption. Okay, what should we do to reduce long-term health risks? Okay, so basically we should advise people with PCOS to have a healthy lifestyle. Okay, eat a healthy balanced diet. Okay, cut down the amount of sugar, salt, and caffeine that you eat and drink. Okay, we also advise to eat meals regularly, okay, especially breakfast. So breakfast should not be skipped at all. Okay, then it's advised to do some exercises regularly. Okay, so 30 minutes at least 3 times a week. Okay, so all these helps to reduce the long-term health risks which I mentioned. And we should also aim to keep the BMI, which is nothing but the weight to height ratio, okay, between 19 to 25. Okay, so ideal BMI, okay, helps in reducing a lot of health risks. okay, including periods abnormalities, and including the health risks due to PCOS. Before that, there is no need to get scared just by seeing the term PCOS. Okay, so the main treatment would be to have some lifestyle modifications, okay, and dietary changes. Okay, so that helps in reducing the effects of the hormonal changes due to PCOS, and as I mentioned, these kind of exercises, reducing the weight, helps in regularizing the cycle. If we reduce at least 10% body weight, okay, there may be regularization of cycles. Okay, so main modality of treatment for PCOS is lifestyle modifications, weight reduction if the patient is on the obese side, okay, and eating a healthy balanced diet, avoiding junk foods. Okay. Okay, so next problem I would say would be excessive weight gain or obesity. So this has increased now from young children to adults. So the incidence of obesity has increased a lot from before. Okay. Okay. So excessive weight gain or obesity is basically determined by some factors. So one main factor is genetic. So suppose if they have familial obesity, okay, so there is a chance that the young girls may also become obese if their parents are obese. Okay, so it is determined kind of by genetics also. Okay, and coming to the metabolism, so each person's body uses energy differently. Okay, so metabolism and hormones, they don't affect everyone in the same way. Okay, uh, so um, so for some people they react in a different way. Okay, so that is the reason why people may feel like I don't eat so much, but I'm putting on weight continuously. Okay, and sometimes some people may feel that they others may eat a lot but they don't gain so much weight. So it all depends on what kind of metabolism is there. Okay, and then not getting enough sleep. Okay, and also some of the lifestyle choices, so not willing to do any kind of exercises, or not willing for any measures to change their food habits, so that can also cause excessive weight gain. And okay, so overeating and an inactive lifestyle. So basically, when a diet full of sugary, high fat, and refined foods are taken, that can lead to excessive weight gain. And there can also be hormonal issues like thyroid disorder. So when the thyroid hormone functioning is not adequate, that can be excessive weight gain also. So all those things have to be corrected. So, why are we worried about this obesity? So, in other words, what are the complications of obesity? So, high blood pressure and high cholesterol. Okay, diabetes may happen, and some joint problems can happen, like pain in the knee joint, or all the weight bearing joints may develop pains, and there can be some kind of breathing problems. Okay, sometimes that can be decreased self esteem because of the appearance. So these are the some of the complications of being obese. Coming to the treatment for obesity, so basically it includes diet counseling, okay, and changes to diet and number of calories eaten. Okay, and maintaining a healthy balanced diet is very important. So not just starving. So it's better to meet a dietitian and get a proper diet chart including adequate calories, proper proteins, okay, and whatever is needed for the health. Okay, and and try to mainly avoid eating excess. Okay, so more physical activity or an exercise program would also help in the treatment of obesity. Okay, So, coming to the behavior changes. So, some people may have an inertia or reluctance to start off exercising regularly, or not willing, as I said, to change the dietary habits. So that also has to be addressed, and some kind of behavior changes has to be brought on them to motivate to start doing exercises. Okay, so support and encouragement from friends, family members, and all our medical community, everything is important as a part of treatment of obesity. So the last thing which I would like to address upon is something which is called as the premenstrual syndrome. Okay, so these are set of symptoms that women may face before getting the periods. Okay, what are the premenstrual symptoms and how to tackle? Okay, so what are the symptoms that a woman may face before her periods? So they are all basically because of the normal hormonal changes that are happening. Okay, so some people may respond differently, having these kind of symptoms. Okay, so they may have you may face mood swings, feeling depressed, irritable, or bad tempered in the premenstrual time. Okay, there may be anxiety or emotional upset. Okay, breakdowns during that time. Okay, that may be excessive tiredness, or some people may have difficulty to sleep. Okay, that can be headaches. Okay, and there may be changes in the food habits, appetite, and feeling of clumsiness may be there. Okay, sometimes that can be fluid retention, and some people may feel bloated. Okay, changes to skin or hair may also happen. Okay, and that can be sore or painful breasts just before the period. So all these are because of the hormonal changes, normal hormonal changes. Okay, so how to tackle? So basically it all depends mainly on lifestyle changes what we make. So doing more exercise, as I already said. So eating a healthy, balanced diet. Okay, trying to reduce and manage stress, for example, by using meditation, yoga, or some mindfulness techniques. Okay, so all these will definitely help in reducing the premenstrual symptoms. Okay, still, if it is not resolved, then you can seek medical help, and we will be evaluating further and decide on further treatment. Okay, thank you all for patient listening, and sorry for the interruptions in between. And now the forum is open for questions. So, any questions?
Good morning, ma'am. I had
Good
one
morning.
query.
Yeah.
Actually, when we are crossing 40 means then automatically we are getting pain in the joints and everything. Is there any correlation between these menstrual cycles and these things, ma'am?
Yeah, so once we cross 40, for some people, it may become the perimenopausal age, which we say, like around the time of menopause is when the hormones stop functioning, and we stop getting periods. Okay, suppose if we are going towards early menopause or something like that. So when the hormones start the functioning starts becoming less, so that time that can be some kind of bone weakness, so that can cause these kind of pains. Okay, but that may also be related to other factors like vitamin D deficiency or calcium deficiency, which is very common in our country. Okay, so that could also be a coincidental factor with age. Okay, so the basic thing is our bone mineral density should be good. Okay, so the vitamin D levels and calcium should be adequate. I hope I answered your question, or anything else you want me to address.
Okay, ma'am. Thank you so much. And also one more
Thank you.
thing, one more student asked about that. That is during adolescence period,
Okay.
hair loss is more. So why
Yeah.
it happens? Just like that, she asked, ma'am.
Okay. Okay. Thank you for the question. Yeah, hair loss is a very common problem. So that may have a lot of reasons actually. That could be, nutritional reasons. Sometimes if we are deficient in some vitamins, that can cause hair loss. Okay, and sometimes that can be other local skin problems in the head, like suppose there is some dandruff or other dryness or some scalp problems that can also cause hair fall. And that can also kind of sleep changes, food habit changes. Okay, so lifestyle changes can also cause stress, can also cause a lot of hair fall. And that can also be associated thyroid conditions leading to hair fall. So if the hair fall is very severe or excessive, it's better to take a medical consult. So we can probably examine and see if there are any local issues with the hair. And probably we can treat accordingly whether any nutritional supplements will be needed or any other kind of evaluation has to be done. Okay, is that okay?
Yes, ma'am. You have done it excellently. Thank you so much for your valuable presentation, and it definitely the students and as well as the society will be benefited by your wonderful talk, ma'am. And thank you so
Thank
much
you.
for
Thank you.
your explanation. Also, thank you.
Thank you very much for this opportunity. Thank you all. Any other questions?
No more questions, ma'am. You have done it very excellently. Now, this is the thank you so much for your valuable presentation, ma'am. Thank you so much. And now, this is the time to deliver the vote of thanks, ma'am. Thank you. Now, I welcome Miss Harita of first year engineering and technology to deliver the vote of thanks.
It gives me an immense pleasure to deliver this vote of thanks to this all dignitaries assembled here. I would like to thank our chief guest for our valuable thoughts and advices of healthy tips to lead a healthy lifestyle. I would like to thank our chairman, founder, joint register of first year ENT, and Dr. P.S. Rajkumar, NSS program coordinator, Dean Activities, professor in CSE department, and all teaching and non-teaching staffs. And last but not least, all our beloved viewers to make this show a glimpse. Once again, I thank everyone and thank you.